Carrier IVF is making new headlines. After conception hurdles and a bout with breast cancer, reality stars Juliana and Bill Rancic have used the procedure to have a baby. This morning, Dr. Stephen Bayer of Boston IVF is here to explain a woman's options when it comes to having a baby. Thanks for being here.
Oh, thank you so much for the invitation.
First of all, what is the difference between a gestational carrier and a surrogate mother?
Okay. There are two different types of surrogacy, gestational surrogacy and traditional surrogacy. So Bill and Julianne went through gestational surrogacy. So they went through an IVF cycle. Julianne's eggs were fertilized with Bill's sperm. They were frozen and then ultimately transferred into the surrogate.
And so this is their biological child?
Exactly.
With surrogacy, it's a little different.
Yeah, so traditional surrogacy is where the surrogate is also the egg donor. So right as the surrogate is getting ready to ovulate, the intended father, we use his sperm to inseminate that woman. She gets pregnant. The concern about traditional surrogacy is that woman has a genetic tie to the fetus, and there could be some difficulty separating her from
giving
the
up
baby.
this baby that's
exactly.
hers. When it comes to Juliana specifically, you know, there were some concerns about, I mean, she's so very thin.
Yes.
And of course, if you have a lower body fat, it may be difficult for you to get pregnant. Is that a factor here at all? Do you think that was one of the hurdles to getting pregnant?
Well, it's difficult to say. You bring up a very important point because weight does impact on fertility, and women who are very thin or women who are significantly overweight can have difficulty in conceiving. But usually IVF overcomes those options. So I don't know the specifics of their underlying diagnosis, but a good percentage of couples going through IVF have unexplained infertility.
I have to ask you because I'm curious. We've seen some celebrities, and of course you don't know necessarily what's going on in their lives or what's going on in their medical history, but like Sarah Jessica Parker and Nicole Kidman, who have had gestational carriers but never really explained, oh, I had trouble getting pregnant. So is there ever a time when it's used for vanity's sake?
Well, sometimes that does come up where a woman wants to use a carrier to avoid the nausea and vomiting associated with pregnancy or the sense of, you know, how it makes her feel or the stretch marks. But at Boston IVF, as well as at all IVF centers, there are strict criteria before you offer this treatment, one of which is a medical problem. So with Julianne, she was dealing with breast cancer. She was undergoing some potentially chemotherapy or taking tamoxifen for a period of a few years. When she's taking those medications, she clearly can't get pregnant because of the impact on the fetus. So that's one reason to consider this, is when there's a medical problem that could potentially worsen during pregnancy or affect the health of the fetus. And the other indication is when she doesn't have a functional uterus, whether that uterus is in place but just can't maintain a pregnancy, or she's had a hysterectomy.
A lot of women who are putting off motherhood will think that they'll want to freeze their eggs for the potential of IVF in the future. Do you recommend that? I know that a lot of doctors say you probably shouldn't.
No, I think egg freezing is definitely an option for the woman who's proceeding with a career and delaying childbearing. She hasn't found the right partner. Clearly, if she's going to consider that, she should do it before the age of 40. But you bring up a very important point about age. Age is the most significant factor that impacts on a couple's chances of getting pregnant or with treatment success. And the problem is with Hollywood, for all those celebrities that get pregnant.
Yeah, you see the 40, 45-year-olds having first-time babies.
And a woman thinks, well, I can wait that long, but many times you can't. So it's better to get, if you've been trying for 6 months, to get to a fertility specialist to try to find a reason why and maybe even consider treatment.
Dr. Stephen Bayer, it turns out my mother-in-law was right. Thank you for joining us this morning and filling us in on that therapy. Brett, to you.
Thank you, Lily. We'll check this.